What do you think when you hear the term sexual dysfunction? Most people think this refers to male erectile dysfunction. In 1998, Viagra hit the market and a sexual revolution occurred. Prior to this, most research in this field was done on men and then generalized to the female population. Contrary to popular belief, more women than men report sexual concerns, 43%, comparable to 31%. My name is Brooke Faught, and I'm a nurse practitioner and the clinical director of the Women's Institute for Sexual Health, a division of Urology Associates here in Nashville, Tennessee. This clinic is geared specifically towards treating sexual and pelvic floor disorders. There are very few clinics in the nation that deal specifically with these issues. We are very proud to have this special clinic here in Nashville. I'm going to give you a brief overview of some common sexual complaints in women. Hypoactive sexual desire disorder, or low libido, is deficiency or absence of sexual fantasies and thoughts for sexual activity. 31% of women report this condition. Female sexual arousal disorder is deficiency or absence of genital tingling and vaginal lubrication with sexual activity. And 21% of women report decreased vaginal lubrication. Sexual aversion disorder is a phobic aversion to sexual contact with a sexual partner. This can be full-fledged intercourse, or it can even just be in any intimate contact. Persistent genital arousal disorder is the unwanted, unwarranted genital tingling and sensation in the absence of sexual activity. There's no prevalence on this condition as of yet, as this is a newer classified condition. Female orgasmic disorder is delay in or complete absence of orgasm following sufficient sexual stimulation. The most important piece of this is that there must be sufficient sexual stimulation. And 25% of women report this condition, which is pretty significant, compared to only 8% of men. Moving on to some pain conditions in women, dyspareunia is just a general term for pain with intercourse. More specifically, vestibulitis is a painful inflammatory condition at the vaginal opening that can lead to a burning sensation with initial penetration, whether with intercourse or even sometimes just with pelvic exams. Vulvodynia is a non-sexual condition where there is pain of the external genital structures. Vaginismus is painful muscle spasm that inhibits the penetration during intercourse or once again with pelvic exams. 14% of women report pain with intercourse. This often inhibits consummation of marriage, which is quite a significant problem within newly married couples. Men and women function very differently when it comes to sexuality, hence why there is no current FDA treatment for women in this field. The good thing is that there is ongoing research and a much bigger interest in female sexuality, even comparable to just a decade ago. At this point, treatment guidelines are holistic and multidisciplinary in nature, as it's important to take into consideration the entire picture with women. Women are a bit more complicated when it comes to treating low libido due to this fact. Here at the Women's Institute, it is our mission to educate, treat, and nurture each woman's need for sexual individuality and better pelvic health. I hope you found this informative.